There you go. You can just hand her the mic.
Good afternoon, Mr. President. I'll try not to cry. I'm trying to figure out what I can do currently. My situation is I had renal cell carcinoma in '98 that was radiated because my dad was dying of colon cancer at the time, and I was his healthcare surrogate on his living will. So I could not be tied up having my kidney removed. So they did radiation procedures to kill the tumor then, and I had insurance and everything was paid for that. But basically, because of the damage that the radiation did in things, I'm no longer able to work, and I have no health insurance. Now I have a new tumor. I have no way to pay for it. The doctors will not see you without paying $100 or $150 to get into their office. I can get checked into a hospital, and under their engineer program, they will run tests and release me, but that costs a lot of money. So currently, I basically, Social Security will not give me disability because renal failure is no longer a qualifying factor under Social Security currently. I cannot get Medicaid through the state of Virginia because you have to be qualified. You have to be considered disabled through Social Security to qualify for Medicaid in the state of Virginia because I have no dependent children at home. It's just me. I get food stamps, but that's it. And I'm just trying to figure out how I'm going to make it 9 years till I'm qualified to get my regular Social Security. Now that I have a new tumor and I have nowhere to treat it.
Well, here, come on over here. First of all, we're going to find out what we'll get your information and we'll see what we can do to help you. I don't want you to feel all like you're alone on this. Without knowing all the details, I'm not going to give you an answer right now about exactly how we can help. We're going to find out what we can do within existing law. But what was your name again?
My name is Debbie. I'm from
Debbie.
Appalachia, Virginia.
Debbie is a perfect example of somebody who we should, in a country this wealthy, be able to provide coverage for her health care problems. And what we don't want is a situation where Debbie gets worse and worse because she's not getting treatment and then ends up having to go to the emergency room. As I said before, all of you will pay for it anyway. It's just you'll pay for it in terms of a hidden subsidy, and she's not getting the best care, and we're actually paying more than we would have if Debbie right now was getting treated on a regular basis by a physician who knew her history. So, Debbie, you are Exhibit A, and we appreciate you sharing your story. We are going to try to find ways to help you immediately, but the long-term problem here is going to be how do we create a system in which Debbie's getting the preventive care that she needs and is able to get regular checkups, is able to get treatment in a way that is much more cost efficient than the one that we've got right now. And I'm going to make a commitment that we're going to get that done this year. All right?
There's a thing in Wise County, Virginia called RAM, Remote Area Medical, and that is Remote Area Medical is where anybody who needs medical treatment can get free treatment for those 3 days, the 24th, 25th, and 26th.
24th, 25th, and 26th.
Of July. So
we will help advertise that.
If you would like to showcase why there's a need, I think they treat Governor Warner and Kane can say how long, but I think it's 7,000 people get treatment there every day of those days, and it's free.
Which is a wonderful program, but I think as Senator Warner and Governor Kane would agree, we can't have a system that's relying on 3 days of free care and 362 days in which people don't have health care. That doesn't make any sense. Debbie, thank you for sharing your story. We appreciate you. Thank you. All right.